One of the topics that often comes up with us, which is the roles of different types of fat. Two of the main categories of fat are visceral fat versus subcutaneous fat. And the patients that we see this most are some of our most common patients, which are abdominoplasty patients. The areas that fat can remain in, one is immediately beneath the skin, which we call subcutaneous fat. And one way to describe that would be that's a very pinchable type of fat. So we can gauge that by whether we can actually grab that tissue and squeeze that between our fingers. That is an area which we're very successful at reforming and creating a new shape with that in the form of an abdominoplasty. With an abdominoplasty, not only do we remove the skin that has some of that subcutaneous fat underneath it, but also we could liposuction various areas and really sculpt that region. The other area that fat can be very sneaky about is it can hide deep within our abdomen near our intestines, and we call that visceral fat. And that often has a little bit more of a roundish look, almost like a potbelly look to that area. The way we determine the difference between the two, again, is what we can physically grab with our fingers. If it is visceral fat, oftentimes we can squeeze some skin and some of the tissues underneath there, but some of it we really can't access with our fingers because it's hidden down near the intestinal area. We'll see that more commonly with some of our male patients than our female patients. Sometimes we'll see a male patient with a barrel-like tummy who's desirous of an abdominoplasty, and when I can find that my fingers cannot really simulate a very flattened appearance, I can tell very instantly that most of their fat is hidden beneath the muscle inside the abdomen, and that's something that I cannot make the appearance that we really would be pleased with afterwards. So those are the patients where we need to make sure their expectations are met precisely. I can give them some advice about how to go through those lifestyle changes to lose that weight and to convert the problem of visceral fat to subcutaneous fat, which we're exceedingly successful at. Fortunately, most patients that we do see really do have more of a problem with subcutaneous fat, and we can use all of our bag of tricks to make that a very flattened appearance. I can simulate the differences that we can make oftentimes with just certain kinds of gestures with my fingers to try to simulate the final appearance. And if we have a result that we think we both would be very happy with, then I'm delighted to be on part of the program. So if you would ever like to have a consultation with me, just reach out to our office and I'd be delighted to.